Hello, I'm Bonnie Erbay, host of PBS's To the Contrary. Welcome to Healthcare for All. The purpose of this special program is to inform small business owners what they can do to close healthcare disparities for their employees. Women-run small businesses have created jobs for some 27 million Americans. Businesses owned by women of color are growing faster than all other types of firms. But providing health care coverage for both themselves and their employees can be one of the most expensive line items for these small businesses. On Healthcare for All today, our panel of experienced leaders will point out what women small business owners can do to provide adequate health care for their employees while maintaining competitiveness in today's tough economic climate. Let me introduce our panel. Congresswoman Eleanor Holmes Norton is serving her 10th term in Congress as delegate for the District of Columbia. She was the first woman to head the Equal Employment Opportunity Commission and is one of the most influential civil and women's rights leaders of our time. Dr. Faye Coleman is the president and CEO of Westover Consultants, Inc. She started her business out of her basement and today manages projects for Fortune 500 companies. In 2007, she was named one of Maryland's top 100 minority-owned business owners. Irene Natividad is a recognized women's leader and runs the DC-based public affairs company Globe Women, Inc. She also organizes the Global Summit of Women, an annual conference for women leaders from around the world. And Cristina Caballero is the founder and director of Dialogue on Diversity, focused on helping women of color find the tools they need to make their small businesses economically viable. Please join me in welcoming the panel. All right, Cristina, why don't we start with you? Okay. Why don't you talk to me about what issues are faced by Latina small business owners and what are the best ways to deal with those issues, and if they have particular needs that other women of color small business owners don't have.
Yeah, well, I guess as far as issues with women, definitely especially with Latina women, as all businesses, money is the big issue. When it comes to health care, they're not able to provide as much as they would like to. So they cannot get along with the minimum, and even worse for those that are not adequately educated. Culture is another issue, and the culture problems Latina business owners face with employees that is not connected with money, for instance, is the psychological and cultural issues. And there are questions of language difficulties when employees go to physicians for treatment or on hospitals. There's the reluctance to go to medical providers at all. And they are baffled by the complications on how to work the system. And they're afraid of all things not to be able to pay for their services. And then they're also afraid of the immigration authorities, of course, and those are the Latina women who employ women in their businesses. And then as far as what they do about them, most employees who need services would ask their friends, their relatives, and so on, to help them pay the cost of their services. And as a matter of fact, they pay something like 40% of whatever money they make to be able to handle their costs.
Healthcare. You were talking about healthcare costs.
Yes.
Okay. Fascinating.
Mm-hmm.
Dr. Coleman, do you have similar issues in your small business, or how do you handle healthcare in your situation?
Well, I've been in business for 25 years, and next to payroll and I guess rent, health insurance is the largest single cost that we have as a business owner. And I have seen healthcare insurance costs rise exponentially, particularly in the last, I'd say, 5 or 6 years or so. One of the things that I have done that has helped to control the cost is work with a knowledgeable HR consultant who has experience in employee benefits, who can help me and our staff, particularly the leadership staff, navigate our way through some of the various options in health insurance that will allow us to do some comparison shopping, the right questions to ask. She also has helped us identify a good small business oriented health insurance broker. And I say small business oriented broker because there are a myriad of brokers out there, and a lot of them are really focused more on large businesses, and therefore they don't really, because the volume, they get more money, and the larger volume, the larger groups and that kind of thing. And so they are not as responsive, they're not as helpful in terms of really knowing what the small business issues that women business owners face. So since we have identified a good, very responsive health insurance small business broker, that's been very helpful. And they helped us to redesign our plan. And we now have a health reimbursement account, HRA, which has actually, in the last, say, 18 months that we've had it, it's resulted in something close to 35% savings in our health insurance coverage.
That's a very good savings tip and a very good idea. Irene Natividad, how do you do it? Or how should it be done?
Well, you know, before we even get into that, I think we have to face a reality. These are probably the toughest economic times for everyone, but especially for small business owners. Last year, 77% of small business owners, male or female, didn't offer health care. This year, it's gone up to 86%. And women business owners are not, exempt from that development. Most small businesses only really have not as big, a group of employees as you have. It's mostly maybe from 1 to 5, if at that. So, yeah.
4.
So there you go. And because a lot of insurance companies do function on the basis of volume, the kinds of brokers who would be attuned to small business issues regarding health care are very few and far between, so most people go without them. But so that said, what I have found to a lot of small business owners to do is to become part of a larger group. So if there are associations, for instance, that provide health care insurance, then the small business could be part of that, and it lowers the cost tremendously. The other way is what you just talked about, the health services accounts. That's becoming very popular because it's like a money pot to which employer and the employee contribute, and you sort of dip into it, whenever you need services. But there is a third way. There's something called, a company called Quick Health that decided that insurance-based primary care is too costly. So what they developed was sort of like a shop, which is drop-in health services, where you come in for just very simple tests that shouldn't have to be covered by insurance. And those are now becoming housed in entities like Walmart or places that people go to frequently. And so it's sort of a retail type of healthcare. And so if you combine that kind of, access to that, plus just some level of catastrophic healthcare, I think small business owners would be attuned to trying to provide some level of health care. But the biggest question, of course, is that we need to repair the whole healthcare system. An employer-based healthcare system is ridiculous. If you have a job in this country, you have health care. If you don't have a job, or you have a job that is part-time contractual, not a full-time job, you don't have health care. That's the majority of women workers. And so, I am